Well, from Kamala Harris to unemployment benefits to nurses rallying outside Valley hospitals, I spoke with Congressman Raul Ruiz about a number of topics. Congressman Ruiz, it's good to see you again. Thanks for joining us.
Good to be on, Peter.
First off, what's the latest in Washington with unemployment?
Well, we know that the negotiations broke down, and we have this executive order that's questionable whether it can be implemented to begin with, and so we need to bring some relief to the American people because we have too many that are unemployed and struggling.
You recently met with the Chambers of Commerce. How are businesses right now?
Well, businesses are very concerned. It's a very slow recovery that's based on public health measures and the county and state's ability to contain and control the virus, which so far we have not done a good job on. So the concern is that if we reach overcapacity in our hospitals and a spike in the coronavirus, that surge interventions will be required, which means that potentially more businesses will be closed, which we don't want that to happen. So it's very important that we contain the virus now during the summer months, while potentially we have a slow season, sort of say, but before we get to the busy season in the fall and winter, when on top of the coronavirus transmission, you're going to have the flu, bronchitis, pneumonia, and other winter seasonal respiratory illnesses that's just going to augment the effects of the pandemic.
Are you worried still then, I guess, that things are going to get worse?
Peter, things will get worse. We need to prepare and believe that it will get worse in order for us to do the right things now. In the fall and winter, if we do not have the coronavirus contained, we will see the coronavirus, the flu, pneumonia, bronchitis, the croup in kids. And because people will be sneezing and coughing more due to these other illnesses, those that potentially were asymptomatic from coronavirus that have the virus will be spreading it even more. So we need to prepare for a bad season to do everything right to mitigate its effect now. If we don't do that now, and our doctors and nurses and hospital workers and our healthcare system is at capacity, over capacity, or fatigued, then imagine how it's going to be in the fall or winter.
Switching gears a little bit, former Vice President Joe Biden selected Kamala Harris as his running mate. Your reaction?
Good. It's always great to have a Californian in the White House, Peter. It's good for our state. It's good for those of us that are fighting for resources that come into our communities in California. So I'm very pleased with that.
All right, let's talk about the nurses here in the Coachella Valley. There's been some rallies outside of Desert Regional. These nurses want new PPE. They don't want to reuse the same PPE over and over. The hospital maintains that it's following CDC and the Department of Public Health guidelines. So who's right and who's wrong here?
Well, nurses, doctors, and healthcare workers has to be our top priority in ensuring that they not only have the necessary equipment that will protect them from getting coronavirus, but that they also feel reassured that they have the communications and the assurance in place where they can feel confident going into taking care of a patient. We already know that the nurses and doctors, healthcare workers are at the highest risk because they are literally taking care of people that have the virus, that are coughing, that are sick, that can easily transmit it. So they need to be our priorities, and we need to be able to provide the PPEs that they need. In the absence of the administration's ability to mass produce PPEs and have them available strategically to nurses, then we have a shortage, and we continue, unfortunately, to have a shortage due to that administration's failure in calling on a massive comprehensive defense production act. With that shortage, there has to be either explanation, reassurance, and a scientific backed explanation as to the efficacy of disinfecting the N95 masks that the nurses use, and walk everybody through the science behind the appropriateness of those modalities. You can use vaporized hydrogen peroxide, you can use UV radiation, and some extreme heat in some cases. But the science is there. There has to be communication. There has to be reassurance, and ultimately, it is the responsibility of the administration of the hospitals to reassure the workers, because man, these nurses are out there in the front line providing love, care, and giving it all they got for the patients. And so I do not want to see a nurse getting infected, getting sick, potentially dying from the coronavirus because they did not have the appropriate PPEs.
Put us in your shoes right now, Congressman. You're not just a lawmaker, you're a doctor. So is it frustrating for you when you're talking about a pandemic and a lot of people, obviously lawmakers included, don't believe this is that big of a deal? You hear comparisons between this virus and the flu, and some people think this is all just exaggeration.
It's very frustrating, Peter. It's frustrating that this mask wearing has been politicized. It's frustrating that there's conspiracy theories believing that this is some kind of a political ploy for a takeover. The only thing I can do is to stay focused on the science and to give the best up-to-date information that I have available as a physician, to implore the public to follow the precautions in order to help the economy, in order to help save lives and to prevent the transmission, especially in our most vulnerable populations. And so this is the key. And one of the irony is that those that want the economy to open without precautions are the same ones that are prohibiting the full recovery of the economy because of their refusal to wear a mask. Their refusal to take the precautions only hurts the economy further. So it all works together if we focus on the known scientifically proven precautions that are very simple to follow. And essentially, if you're in public around other people within 6 to 8 feet, wear a mask. Stay 6 to 8 feet apart in any scenario that you can. Wash your hands frequently. If you can avoid going outside, stay at home with the family, and we will get a hold of this if we can follow those very simple precautions.
All right, Congressman Ruiz, we appreciate your time. Thanks for joining us again.
Thank you.